Imagine you are not pregnant. Then boom, bam, you are now pregnant. What is there to expect after that? Even if you're a man, you're about to learn a lot about an extreme ability that half the population is able to perform.
It's pretty incredible, right? What the female body can do. We're diving deep into pregnancy today, specifically for you first-year nursing students just starting out in women's health.
You're stepping into a whole new world. Pregnancy is a wild 9-month ride for the human body. Get ready for a crash course in all things pregnancy. We're covering both the common changes and maybe some of the more surprising ones too.
Yeah, you'll come away with a solid grasp of the essential adaptations and why they matter for nursing care.
Okay, let's start with the basics then. How about a quick rundown of the trimesters? What weeks do they cover and what are the big milestones?
Great place to start. So we've got 3 trimesters, each about 3 months long. The first trimester is weeks 1 through 12, and it's all about laying the foundation. The embryo implants, organs begin to form, and those early pregnancy signs start popping up. The second trimester, weeks 13 to 26, that's when things really get going. The fetus grows rapidly, and the mother might start feeling those first flutters of movement.
Oh, wow.
And finally, the third trimester, from week 27 to birth, is the home stretch. Weight gain, final development, and preparation for life outside the womb.
Wow, a whirlwind of development in just 9 months. Now, one thing that's always mind-blowing to me is how much the uterus grows.
Oh.
We're given a dramatic transformation, right?
Absolutely. It goes from the size of a pear, weighing just a couple of ounces, to something more like a watermelon, reaching over 2 pounds.
That's wild.
This incredible growth is driven by estrogen, and it provides space for the growing fetus.
I can only imagine how much strain that puts on a woman's body.
Yeah.
And it's not just about the size. There's a lot happening with blood flow too, right?
You're right. Blood flow to the uterus increases dramatically to nourish both the mother and the developing baby. This increase in blood volume is a key adaptation, and it's something you'll want to keep in mind when monitoring a pregnant woman's vital signs.
That makes sense. Speaking of down there, the cervix, the gatekeeper of the uterus, also goes through some fascinating transformations during pregnancy.
Right. Early on, a mucus plug forms, sealing off the cervix to protect the developing fetus from infection. You'll also notice changes like softening and a bluish discoloration, known as Goodell's and Chadwick's signs, due to increased blood flow. These are important clinical indicators of pregnancy.
Oh, wow. Okay.
Yeah.
It's like the body is putting up all these protective barriers and sending signals to indicate that something extraordinary is happening. There's like its own secret language.
Yeah.
So what about hormones? Pregnancy is basically one giant hormonal roller coaster ride, isn't it?
You could say that. Progesterone and estrogen are the key players, orchestrating all the changes we've been talking about. Progesterone is crucial for maintaining the pregnancy. It keeps the lining of the uterus thick and healthy for the embryo to implant and grow. It also relaxes smooth muscles, which is why many women experience constipation and heartburn. Interestingly, in early pregnancy, progesterone is produced by the corpus luteum, but around week 7, the placenta takes over.
Oh, wow. So the placenta is like a multitasking powerhouse.
Yeah.
And what about estrogen? What's its main gig in all this?
Estrogen is all about growth and development. It stimulates the growth of the uterus and breasts, increases blood volume, and can also contribute to some of those less pleasant pregnancy symptoms, like nausea and fatigue.
Speaking of breasts, let's talk about those changes. They're pretty hard to miss, right?
You're telling me. Estrogen and progesterone cause breasts to enlarge and become more sensitive as they prepare for milk production. You'll notice more prominent veins, darkening of the areolas, and even the appearance of colostrum, that nutrient-rich first milk. It's pretty incredible how the body is already preparing for breastfeeding even before the baby arrives.
That is amazing. So we've got the uterus expanding, the cervix changing, hormones surging, and breasts prepping for a whole new job. It's like a total body makeover. What about the cardiovascular system? It must have to work overtime to handle all these changes.
You bet it does. To keep up with the demands of pregnancy, blood volume increases by an incredible 40–50%. Wow. That's a lot of extra fluid for the heart to pump. Cardiac output increases to circulate all that extra blood, and you might also see a slight increase in heart rate. As for blood pressure, it often dips a bit early on, but can rise toward the end of pregnancy. It's something you'll want to monitor closely as you're caring for pregnant women.
Okay, that makes sense. So we've covered some of the dramatic changes happening internally. Now let's talk about those less glamorous aspects of pregnancy, the nausea, constipation, heartburn. I know you've got some insights on how these things happen and hopefully some tips for managing them.
Well, let's start with the dreaded morning sickness. It's actually not just a morning thing and can strike at any time. Those fluctuating hormones, especially the surge in HCG early on, are the main culprits. While it's usually mild, it can be pretty debilitating for some women. As for constipation, blame it on progesterone again. It relaxes the muscles in the digestive tract, slowing things down. Increasing fiber intake and staying well hydrated can help keep things moving.
Okay, that's a good tip to remember. And what about heartburn? Is that also a progesterone side effect?
It is. Progesterone relaxes the valve between the esophagus and the stomach, allowing stomach acid to splash back up, causing that burning sensation. Eating smaller meals and avoiding trigger foods can help.
So it's like pregnancy is a trade-off. Creating new life comes with some, let's say, interesting side effects. Speaking of changes, what about the skin? I know a lot of women experience noticeable differences during pregnancy.
Right. The surge in hormones, combined with the stretching of the skin, can lead to a few common changes. You've got the linea nigra, that dark line that appears down the abdomen, and chloasma, also known as the mask of pregnancy, which causes patches of darker skin on the face. And then there are stretch marks, those silvery streaks that can appear on the abdomen, breasts, and thighs as the skin stretches.
I bet those stretch marks cause a lot of anxiety for expectant moms. Is there anything they can do to prevent them?
Well, while there's no foolproof way to prevent stretch marks, keeping the skin well hydrated and gaining weight gradually during pregnancy can help minimize their appearance. And the good news is that they often fade after pregnancy.
That's reassuring. Now let's talk about weight gain. It's essential for a healthy pregnancy, but it's not about eating for two, as some people might think. How much weight gain is generally recommended?
You're right, it's all about healthy weight gain, and the recommendations vary depending on the woman's pre-pregnancy BMI. For women who start at a healthy weight, the range is typically 25-35 pounds. Gaining too much or too little weight can increase the risk of complications.
So it's another area where monitoring and providing guidance is crucial for nurses. Now let's delve into antenatal testing, those procedures used to assess fetal well-being. What are some of the key tests that you'll encounter as a nurse?
One of the most well-known is amniocentesis, a procedure where a small amount of amniotic fluid is extracted from the sac surrounding the baby. This fluid contains fetal cells, which can be analyzed for genetic abnormalities, lung maturity, and other conditions. It's typically performed in the second trimester.
That's fascinating. It's like getting a sneak peek into the baby's world. But I've heard there are some risks associated with amniocentesis.
You're right. Amniocentesis does carry a small risk of complications like miscarriage or infection, so it's not performed routinely. It's typically reserved for situations where there's an increased risk of certain conditions.
So it's a decision that's made carefully, weighing the risks and benefits. What other antenatal tests are commonly used?
Another important test is the non-stress test, or NST. This non-invasive test monitors the baby's heart rate in response to its movements. It's a simple and safe way to assess fetal well-being, and it's often used in the third trimester.
Okay, so amniocentesis provides detailed genetic information, while the NST gives us a real-time snapshot of the baby's heart rate and activity. It's amazing how technology allows us to monitor fetal well-being. Now, let's talk about labor and delivery, the grand finale of pregnancy.
It's the culmination of all those months of preparation and change. As labor approaches, the body starts sending signals that it's time. The cervix begins to soften, thin out, and open up a process known as effacement and dilation.
So the body is literally paving the way for the baby's exit. What are some of the signs that labor is imminent? I know those first-time moms are always on high alert for their water breaking.
While a dramatic gush of amniotic fluid is what often comes to mind, it can also be a slow leak for some women. Regular intensifying contractions that don't let up with rest are another sure sign that labor is underway. And you might also see a bloody show, a small amount of blood-tinged mucus discharge as the cervix starts to change.
It's like the body is sending out a series of announcements, letting everyone know that it's time for the main event. So what exactly happens during labor? I imagine it's an intense and complex process.
It is. We can think of it as a series of coordinated events involving 5 key factors, often referred to as the 5 Ps: passenger, passageway, powers, position, and psychological response.
Okay, I'm intrigued. Let's unpack these 5 Ps one by one.
Right.
What does passenger refer to?
The passenger is the baby, of course. Its size, position, and presentation all play a role in how labor progresses. A larger baby, or one that's not head down, can make labor more challenging.
That makes sense. So it's like navigating a delicate puzzle, making sure the baby's in the best position for a smooth exit. What about passageway?
The passageway refers to the mother's pelvis. The size and shape of the pelvis can affect how easily the baby can pass through.
So every woman's body is unique, and the shape of her pelvis can influence the labor process. What about powers? That sounds intense.
The powers are the contractions, those rhythmic muscle contractions that propel the baby down the birth canal. The frequency, duration, and intensity of contractions all contribute to the progress of labor.
It's incredible how the body orchestrates this powerful force to bring new life into the world. What about position? Does the mother's position during labor make a difference?
Absolutely. Different positions can influence the effectiveness of contractions and help the baby descend more easily. Encouraging women to move around and find comfortable positions can help labor progress more smoothly.
So it's not about lying in bed and passively waiting for things to happen. Movement and finding the right positions can actually help. What about the final P, psychological response?
That's a crucial aspect of labor. A woman's emotional and mental state can significantly impact the labor process. Fear, anxiety, and lack of support can make labor more difficult, while feeling calm, confident, and supported can help it progress more smoothly.
It's like the mind and body are working together in this incredible dance of bringing new life into the world.
Right.
So we've got the baby making its way through the birth canal, guided by the forces of contractions and influenced by the mother's position and emotional state. It's amazing how everything comes together. What happens once the baby is born?
Well, that's just the beginning of a whole new chapter. But first, there's one more stage of labor, the delivery of the placenta. That remarkable organ that has nourished and sustained the baby throughout pregnancy. The uterus continues to contract, helping to detach and expel the placenta, usually within 30 minutes after the baby is born.
The placenta is truly the unsung hero of pregnancy. What happens if it doesn't detach properly?
That's called a retained placenta, and it can lead to complications like bleeding or infection, so it's something we monitor closely as nurses.
It sounds like nurses play a vital role in ensuring a safe and smooth transition from pregnancy to motherhood.
We do. Once the placenta is delivered, we shift our focus to the immediate postpartum period, supporting both the mother and the newborn as they adjust to their new roles. Yeah, it certainly is. For you, first-year nursing students, I bet you're thinking about all the things you're going to learn and experience.
It's one thing to read about it in textbooks, but it's another to be right there, witnessing the miracle of childbirth and supporting women through this incredible journey.
Absolutely. It's an experience that will stay with you forever. Now, let's talk about some of the potential complications that can arise during pregnancy. It's important to be aware of these possibilities, even though most pregnancies progress smoothly.
Okay, so let's delve into some of the challenges that nurses might encounter in maternity care. What are some of the common complications that can occur during pregnancy?
One complication that we unfortunately see sometimes, especially in the first trimester, is spontaneous abortion, more commonly known as miscarriage.
That's a topic that must be difficult for both patients and healthcare providers to navigate.
It is. It's the unintended loss of a pregnancy before 20 weeks of gestation, and it's more common than many people realize. The causes can vary. Sometimes it's due to chromosomal abnormalities in the fetus. Other times it might be related to maternal health conditions or lifestyle factors. But in many cases, the exact cause remains unknown.
So it's a complex issue, and it's essential for nurses to provide compassionate and supportive care to women who experience this loss. What other complications should we be aware of?
Another serious complication is ectopic pregnancy, which occurs when the fertilized egg implants outside of the uterus, most commonly in the fallopian tubes.
I've heard that ectopic pregnancies can be life-threatening.
Yes, they can. As the embryo grows, it can cause the fallopian tube to rupture, leading to internal bleeding. Recognizing the signs and symptoms early on is crucial.
What are some of those red flags that nurses should be looking for?
Abdominal pain, vaginal bleeding or spotting, and shoulder pain, which can be a sign of blood irritating the diaphragm. Those are all warning signs that should prompt immediate medical attention.
Okay, so those are two serious complications that can occur early in pregnancy. What about later in pregnancy? Are there other potential problems that we should be on the lookout for?
Yes, as the pregnancy progresses, other complications can arise. One condition to be aware of is placenta previa, which occurs when the placenta partially or completely covers the cervix.
And why is that a problem?
Well, as the cervix begins to thin and dilate in preparation for labor, the placenta can detach, causing bleeding.
That sounds dangerous.
It can be. Placenta previa can lead to heavy bleeding, preterm labor, and other complications. The management depends on the severity, but it might involve bed rest, close monitoring, and possibly a cesarean delivery.
So it's a condition that requires careful observation and intervention. Are there other placental complications that we should be aware of?
Yes, another one is placental abruption, which occurs when the placenta separates from the uterine wall prematurely.
And that can also lead to bleeding.
Right. Yes, it can cause heavy bleeding in the mother, and it can also disrupt the flow of oxygen and nutrients to the baby, leading to fetal distress.
Wow, it sounds like the placenta plays such a vital role, and any problems with it can have serious consequences.
Exactly. It's the lifeline between the mother and the baby, and we need to monitor it closely throughout pregnancy.
Now let's talk about preeclampsia, a condition that I know can be quite concerning.
Preeclampsia is a serious condition that typically develops after 20 weeks of gestation and is characterized by high blood pressure and protein in the urine. It's thought to involve problems with the placenta, and it can lead to serious complications for both mother and baby.
What are some of those potential complications?
Preeclampsia can progress to eclampsia, which involves seizures. It can also damage the mother's organs, including the liver and kidneys. And for the baby, it can lead to preterm delivery, low birth weight, and other problems.
So it's crucial to recognize the signs and symptoms early on and intervene promptly.
Absolutely. Monitoring blood pressure and urine protein levels throughout pregnancy is essential, and if preeclampsia is diagnosed, treatment focuses on managing blood pressure and preventing seizures.
What about gestational diabetes? Is that something we should be concerned about during pregnancy?
Yes, gestational diabetes is a type of diabetes that develops during pregnancy. It's caused by hormonal changes that interfere with the body's ability to use insulin effectively.
And what's the big concern with gestational diabetes?
High blood sugar levels can cross the placenta and affect the developing baby, potentially leading to complications like macrosomia or a larger than normal baby, as well as respiratory problems and low blood sugar after birth.
So managing blood sugar levels during pregnancy is crucial for both the mother's and the baby's health.
Exactly. Treatment for gestational diabetes typically involves dietary modifications, regular exercise, and sometimes insulin injections.
Okay, so we've covered some of the potential complications that can arise during pregnancy. Now let's shift our focus to labor and delivery. I know this is a time of great anticipation, but also some anxiety for many women.
It's definitely an exciting but also somewhat unpredictable time. While most labors and deliveries proceed smoothly, it's important to be aware of potential complications that can occur during this stage as well.
Let's dive into some of those challenges. What are some of the common complications that can arise during labor and delivery?
One concern is preterm labor, which is defined as labor that begins before 37 weeks of gestation.
And why is preterm labor such a concern?
Babies born prematurely are at increased risk for a variety of health problems, including respiratory distress, feeding difficulties, developmental delays, and vision and hearing problems.
So the earlier a baby is born, the greater the risk of complications.
Exactly. That's why we focus on preventing preterm labor whenever possible and providing specialized care to premature infants if they are born early.
What are some of the factors that can increase the risk of preterm labor?
Several factors can contribute, including a history of previous preterm birth, multiple gestation, infections, certain medical conditions like diabetes and high blood pressure, and lifestyle factors like smoking and drug use.
So it's a complex interplay of factors, and prenatal care plays a crucial role in identifying those who are at increased risk and implementing strategies to prevent preterm labor.
Absolutely. Early detection and intervention are key. Now, another complication that can occur during labor is prolonged labor.
What's considered a prolonged labor?
Labor that lasts longer than 20 hours for first-time mothers or longer than 14 hours for women who have given birth before is generally considered prolonged.
And what causes labor to go on for longer than expected?
A few things can contribute to prolonged labor, including a large baby, an unfavorable fetal position, a slow or inefficient cervix, and weak contractions.
So it's like a puzzle, figuring out what's causing the delay and implementing appropriate interventions to help things progress. What are some of the potential risks associated with prolonged labor?
Prolonged labor can be exhausting for the mother, increasing her risk of infection. It can also lead to fetal distress where the baby isn't getting enough oxygen. In some cases, prolonged labor might require interventions like assisted delivery with forceps or vacuum extraction, or even a cesarean delivery.
It sounds like nurses need to be skilled in monitoring the progress of labor, recognizing signs of potential problems, and collaborating with other healthcare providers to make informed decisions about interventions.
You're absolutely right. It's all about teamwork and critical thinking to ensure the best possible outcomes for both mother and baby. Now let's talk about fetal distress, a complication that can occur during labor.
Fetal distress, that sounds scary. What exactly is it?
Fetal distress occurs when the baby isn't getting enough oxygen or is experiencing other problems that compromise its well-being.
So it's essentially a sign that the baby is in trouble. What causes fetal distress, and what are some of the signs that nurses should be looking for?
The causes of fetal distress can vary. It can be due to problems with the placenta, the umbilical cord, or the baby itself. Signs of fetal distress can include abnormal fetal heart rate patterns, meconium staining of the amniotic fluid, and decreased fetal movement.
So nurses need to be vigilant in monitoring the baby's well-being throughout labor and recognizing those red flags that might indicate distress. What are some of the interventions that can be used to address fetal distress?
Depending on the cause and severity of the distress, interventions might include repositioning the mother, administering oxygen, increasing intravenous fluids, and possibly expediting delivery.
It sounds like a situation that requires quick thinking and decisive action.
It does. Prompt recognition and intervention are crucial for improving outcomes in cases of fetal distress. Now, let's discuss another complication that can occur during delivery: shoulder dystocia.
Shoulder dystocia, what is that?
Shoulder dystocia happens when the baby's head is delivered, but one or both shoulders get stuck behind the mother's pubic bone. It's a serious complication that requires immediate action to prevent injury to both the mother and the baby.
I can only imagine how frightening that must be for everyone involved. What can be done to resolve shoulder dystocia?
There are several maneuvers that can be used, including applying pressure above the pubic bone, repositioning the mother, and sometimes even fracturing the baby's clavicle to facilitate delivery. It's a situation that requires skill and experience to manage effectively.
It sounds like nurses need to be prepared to assist in these emergency situations and to provide support and reassurance to the mother and her family.
Absolutely. It's a stressful situation for everyone involved. Now, another complication we need to be aware of is umbilical cord prolapse.
Umbilical cord prolapse. I've heard of that, but I don't fully understand it.
Umbilical cord prolapse occurs when the umbilical cord slips down into the birth canal ahead of the baby. This is dangerous because the cord can become compressed, cutting off blood flow to the baby.
That sounds terrifying.
It's a medical emergency that requires immediate intervention to prevent fetal hypoxia and brain damage.
What are some of the actions that nurses can take if umbilical cord prolapse occurs?
Interventions might include manually elevating the presenting part of the baby to relieve pressure on the cord, repositioning the mother, and possibly expediting delivery.
So it's another situation where quick thinking and decisive action are critical.
Exactly. It's all about staying calm, assessing the situation quickly, and taking appropriate steps to protect the baby's well-being. Now, let's move on to potential complications that can arise after the baby is born during the postpartum period.
Okay, so the baby has arrived, but the journey isn't over yet. What are some of the challenges that nurses might encounter during postpartum care?
One significant concern is postpartum hemorrhage, or excessive bleeding after delivery. It can be life-threatening if not addressed promptly.
What causes postpartum hemorrhage? And what are some of the things that nurses can do to manage it?
Postpartum hemorrhage can be caused by various factors, including a failure of the uterus to contract properly after delivery, retained placental fragments, trauma to the cervix or vagina, and bleeding disorders. Interventions might include uterine massage to encourage contractions, administering medications to control bleeding, and sometimes surgical procedures.
So it's a condition that requires a multifaceted approach, addressing the underlying cause and implementing appropriate interventions to control the bleeding.
Exactly. It's a team effort involving nurses, physicians, and other healthcare professionals working together to stabilize the patient.
Now, what about infection? Is that a concern during the postpartum period?
Yes, postpartum infections can occur involving the uterus, the bladder, the breasts, or the incision site after a cesarean delivery.
What are some of the signs and symptoms that nurses should be watching for?
Signs of infection might include fever, chills, abdominal pain, foul-smelling discharge, redness or swelling at the incision site, and pain or burning during urination.
So it's essential to monitor postpartum women closely for any signs of infection and to initiate treatment promptly if necessary.
Absolutely. Early diagnosis and treatment are key to preventing serious complications. Now let's talk about mastitis, a condition that can affect breastfeeding mothers.
Mastitis. I've heard that term. What is it exactly?
Mastitis is an inflammation or infection of the breast tissue. It's often caused by a blocked milk duct or bacteria entering the breast through a cracked or sore nipple.
And what are some of the signs and symptoms of mastitis?
Symptoms can include breast pain, redness, swelling, warmth, fever, and flu-like symptoms.
So it's essential to educate breastfeeding mothers about mastitis, how to prevent it, and what to do if they develop symptoms.
Exactly. Simple measures like frequent breastfeeding or pumping, proper latch techniques, and good hygiene can help prevent mastitis. And if it does occur, treatment typically involves antibiotics and continued breastfeeding or pumping to drain the infected milk duct.
So it's important to reassure women that they can usually continue breastfeeding even if they have mastitis.
Absolutely. It's not only safe but also beneficial to continue breastfeeding as it helps to clear the infection.
Now, let's shift gears a bit and revisit postpartum mood disorders. We talked about them earlier, but I think it's worth emphasizing their importance again.
You're right. Postpartum mood disorders are a significant concern, and it's crucial for nurses to be knowledgeable about these conditions and how to support women who are struggling.
What are some of the key things that nurses should keep in mind about postpartum depression and anxiety?
First and foremost, it's important to remember that postpartum mood disorders are not a sign of weakness or failure as a mother. They are treatable medical conditions, just like any other illness.
That's such an important message to convey to women who might be feeling overwhelmed or ashamed of their struggles.
Absolutely. We need to create a safe and non-judgmental space for women to share their feelings and seek help.
What are some of the specific things that nurses can do to support women with postpartum mood disorders?
We can provide information about support groups, counseling services, and medication options. It's also crucial to listen attentively, validate their feelings, and reassure them that they're not alone in this.
So it's about providing a combination of resources, emotional support, and practical guidance.
Exactly. Our goal is to empower women to take charge of their mental health and to connect them with the resources they need to heal and thrive.
I think we've covered a lot of ground today. From the physiological changes of pregnancy, to the potential complications of labor and delivery, to the challenges and rewards of postpartum care. It's a lot to absorb, especially for first-year nursing students who are just starting their journey in women's health.
It is a lot of information, but it's all essential knowledge for providing competent and compassionate care to women and their families.
What are some key takeaways that you want to leave our listeners with today?
First and foremost, remember that pregnancy, labor, delivery, and postpartum recovery are all normal physiological processes. While complications can arise, most women experience these events without major problems. Your role as a nurse is to support and guide them through this journey, providing education, reassurance, and skilled care.
What advice would you give to those first-year nursing students who are feeling a bit overwhelmed by all this information and the responsibility that comes with caring for pregnant women and their babies?
My advice would be to embrace the learning process, ask questions, seek guidance from experienced nurses, and never lose sight of the incredible privilege it is to be a part of this journey.
I think that's a wonderful note to end on. It's about approaching this field with humility, curiosity, and a genuine desire to learn and grow, and to always remember the profound impact that nurses have on the lives of women and their families.
Absolutely. It's a career path filled with challenges and rewards, and I encourage you to embrace it fully.
And to our listeners, thank you for joining us on this deep dive into the world of maternity nursing. We hope you found it informative and inspiring.
Until next time, keep learning, keep growing, and keep diving deep.